faces many public health problems, but with good strategies and an in-depth understanding of these problems, the health of all Salvadorians can be improved. One way of determining what the problems are causing the greatest burden of disease is to look at DALYs. In El Salvador, the cause of most DALYs is non-communicable diseases. The second largest cause of DALYs is communicable diseases, and the third largest cause of DALYs is injuries. Another key piece of information that must be provided if the health of Salvadorians is going to be improved efficiently is the top causes of death in adult Salvadorians.
The three main public health issues are cardiovascular disease, infectious disease, and neuropsychiatric conditions. Cardiovascular disease, such as coronary heart conditions, is the second most frequent cause of death in El Salvador. It accounts for 25% of El Salvador's proportional mortality rate, and this is due to high blood pressure and high cholesterol. Infectious disease such as dengue fever and malaria are examples of vector-borne disease. It has been an endemic problem with epidemic outbreaks during the past decade. This is due to poor water management skills and sanitation by the country, which will in turn increase the transmission rates. Lastly, the neuropsychiatric conditions are on the rise due to mental health awareness. Depression and violence due to alcohol is caused by the epidemiological condition El Salvador faces. Homicide rates are on the rise. About 10.8 homicides happen every day. People that are affected by depression and violence will increase crime rates, which will in turn create a human security issue. This is why we should focus on mental health awareness compared to other causes of death in El Salvador. Rapid globalization has caused healthcare systems, human resource, and infrastructure to decrease in efficiency. Crime rates increase and people get sicker from non-communicable diseases will financially hurt El Salvador. This is due to the decrease in productivity levels, which can in turn be shown in a decrease in GDP.
Parallel relationship between a person's age and their inherent risk towards coronary heart disease. It seems that as people age, the likelihood of this disease increases, but it's not to say that men and women share the same burden, but rather men share greater burden at every age compared to women. Unhealthy lifestyles such as smoking and obesity also contribute to the likelihood of coronary heart disease. Concerning neuropsychiatric diseases, an individual's lifestyle choices and life events may also promote depression. Choice of obesity and traumatic life events such as the death of a loved one can also increase the likelihood of depression. Lastly, we'll discuss the risk factors of dengue fever. Its main transmission are through mosquito bites, but furthermore, transmission can also occur through blood contact.
The method would be the policy development of public or universal health care in El Salvador. Since El Salvador is a lower income country, a policy development can save money for people, and people would be likely to seek a preventative care through public funded health care policies. Free or cheap screening can also identify people more prone to chronic diseases. In addition, immunization can lower the burden of disease and prevent infectious diseases. Health promotion and health teaching towards the media is also important, in which schools need more attention and they need to change their attitudes towards health. Three main levels of interventions. The first level would be the individual level. They can focus on how individual receives services. The second level would be the community level, in which how health is promoted through schools and community centers. The third level would be population level, in what improves health of overall population. An example, foreign policy.
Suggested action plans are brilliant. El Salvador is currently suffering from money and funding crisis. The gross national income per capita in El Salvador is 80% lower when compared. Therefore, high-income countries like United States and Japan and national organizations such as United Nations should hold conference and ensure that lower-income countries receive maximum help and funding. As well, regional countries should provide and share resources such as nurse practitioners. This is a win-win situation where nurses gain experience and El Salvador has more health workers.